Good day and welcome to the Power Up. Helps to come off mute so you can hear all the inspiration and information we have to share. Welcome. I'm your host, Tami Hill Thomas. Looking forward to a power pack segment to equip, educate, empower, and elevate all of us to make a difference where we are. Let's start with Inside the News. Today, we discuss the elevated alert by the U.S. Agency for International Development. USAID.gov has elevated the need for the alarming support in the humanitarian efforts taking place in Sudan and Haiti. Sudan faces the sad effects of ongoing conflict, economic shock, political unrest, and recurrent environmental hazards, such as drought and flooding, resulting in 15 million people requiring humanitarian response. The UN Humanitarian Response Plan for Sudan, established it last year in 2023, was meant to help impact such this urgent issue, including the one set for Haiti. Both areas need our awareness and assistance when able. On April 15th, 2023, a huge conflict was ensued in Sudan, for example, and paramilitary had to respond with the Sudanese armed forces, causing a exasperated humanitarian need across that country. Can you imagine already being in a place where you're dealing with the deficiencies in just the basic necessities of life, and then having it increased and elevated by the environmental hazards, by things that go on around you out of your control? USAID is responding to the humanitarian crisis with emergency assistance to access the security in that area, and helping to provide increased needs and increased services for those vulnerable populations, conflicted communities, regular human beings like you and us that happen to be natives in that land and need the assistance. The United States has also declared a disaster and issued a declaration of humanitarian need to help our brothers and sisters in both Sudan and Haiti. That's the largest international donation of humanitarian assistance, specifically put in Sudan. Great that the United States is providing partial, important, needs based assistance to the vulnerable and conflict affected populations. Do you know that conflicts aren't always something that we seek to have? Many times we're subject to things around us. You can be the difference. Go to usaid.gov. The U.S. Agency for International Development has statistics and facts on what's going on in Sudan and Haiti, on all of their efforts, along with the timeline of events, and yes, how you can help. We also want to take this opportunity to elevate an alarm by the World Health Organization. The World Health Organization has shared statistics recently on the top 10 causes of death around the globe. You can first go to who.int at any time to get this information. They have increased statistics that they've been watching globally every year and how the increases are elevating. So this isn't just an American thing. See, the World Health Organization has elevated that the top 10 causes of death seem to all fall in cardiovascular, that being heart disease, strokes, respiratory, pulmonary disease, how we deal with respiratory infections, and even neonatal conditions. Yeah, those that are affected, our babies, by birth traumas, by birth asphyxias, neonatal sepsis, and infections. And how about preterm birth complications? Knowing what the causes of death are help us to be better individuals, help our families to be stronger because we get educated so that we can know what needs to happen in our homes, in our communities, all around us. That's what makes a change globally. The causes of death primarily fall in three categories. Communicable, which everyone recalls with the COVID pandemic, that's infectious, those type of parasitic diseases. And non-communicable, as well as maternal, perinatal, and nutritional causes. So as we look a little bit closer, let's do this. Let me give statistics to my folks. 7 of the 10 leading causes of death in 2019 were non-communicable diseases. Now remember, the pandemic became a pandemic. That meant that there were enough global cases of it that the World Health Organization elevated it as an alarm, and it got global attention. It wasn't just a America thing, or it wasn't just across the water. It was global. Well, that kicked in. Finally came a determination in 2020. So prior to the pandemic, 7 out of 10 leading causes of death were non-communicable. One of the reasons healthcare providers push that all-important flu vaccine, now the COVID vaccine. Do you know that that means that 44% out of 80% were the causes of those deaths? The numbers now, this is statistics. Non-communicable in itself, so we're not necessarily talking about the prenatal conditions, what happens with poor birth control or poor care when you're pregnant, or even genetics. Just the fact that there are things that affect us in the air that we breathe, why that mask made a difference. Here with Inside the News is our job on the Power Up to elevate this information. Know what the primary causes of death are: stroke, heart disease. Know that diabetes is number 9 on the global list. Kidney disease, Alzheimer's disease. Family, we may hear these when it affects someone else, but how about preparing so that you're in a better place should you and your family ever have to face one of these issues? We're human. We're in this body, not meant to live forever, but certainly doing our best to be our best. Get educated, get equipped. Go to the World Health Organization, WHO.int, to get all the information about the leading causes of death globally. What you need to know. Do you know how many people I know personally that are affected by diabetes? Never thought that it was a global, on the list of the top 10 global causes of death. Because taking prescriptions is maintenance. What you do in addition to those medicines is what is the cure, is what helps us to be amazing on a daily basis. We hope this information was helpful. Our job, again, is to equip and educate. And family, we're excited to bring a very special guest. After these commercials, stay tuned because there's more after this.
Hey everybody, this is Regina Hutt, the wellness practitioner on Empowered Mornings. We'd like to invite you every Wednesday night, 8 p.m., uniquely and gorgeous, to keep your mind locked and loaded on WIN Network.
Welcome back to the Power Up. We're so glad that you're joining us today as we bring content that's life-changing. So how about we share this platform with one of the most amazing superheroes that I personally know. I'm excited to bring today a true healthcare professional. We have as our special guest, Miss Lynnae Elliotte. Lynnae is a registered nurse. She's a nurse manager. All of her work is caring and giving to others in the medical professional and in her community work. Thank you so much for joining us, Lynnae. Welcome to the Power Up.
It is my pleasure. Thanks for having me.
Oh, absolutely. Let's kick it off. Listen, I know your time is vital. We know you're actually sitting in the hospital right now, took time from your job to be able to speak to us. So let's go right to some content and information that can be helpful. First, you heard some of the statistics that I shared, how important it is for our communities to be educated in how we can help care for ourselves. On the medical side, yours certainly your skills span so many different parts of the medical profession, being part of the John Hopkins Hospital and the University of Maryland Medical Center. Share any insight and tips we should know.
Well, I would say the first tip I would say would be to wash your hands um, often. I feel like that could be the main tip that we support and speak to at the hospital. And we have hand sanitizer everywhere you go. So before you touch something, after you touch something, wash your hands because you'll just spread whatever you touched everywhere else you go. That would be the biggest thing I would say, be the biggest impact you can make. Of course, our hospital, we mask when we need to mask. Right now, because we're not in the middle of the height of a pandemic anymore, masking hasn't become as big of a big deal, but we still do it when we need to do it regarding the patient interaction that we're having, but not so much with the public, but with the patients, because patients can be vulnerable, but there can be immunocompromised, there can be transplant patients, there can be oncology patients. So we got to make sure we protect the patients from us who are outside doing a lot of different things, and we don't want to come into the hospital and bring the outside into them and make them sick. So I would say to two things. I say the biggest thing is to wash your hands would be the biggest thing I would want to convey.
Wow, and certainly that's something we take for granted. And I heard one story from a gentleman who, when he got off the respirator after COVID, he said, I can tell y'all exactly when I got it. I was with someone who was coughing, and I touched my phone, and then I touched my nose. And after that, I got sick. And he said, my hands are always scrolling. I'm always touching my phone and always touching my nose and never thought about it. Thank you for those tips. I want to delve a little bit deeper if I can, because you're right.
Yes.
Safety is so important. So, in the medical field, you see a heightened state of so many different diseases and so many things that come across you we may never see. What can we do to make a difference where we are?
Oh, that's an excellent question. I would say the biggest thing would be, I mean, you never know what people are going through. You never know. You can walk on an elevator with somebody and have no idea they'd be going through cancer treatment, or they just came from dialysis, or or that one of their loved ones is dealing with something. You just never know. So I would say one is kind of, you know, get out of self would be my biggest thing when you're interacting with the community and the public. I know you're trying to, get where you're trying to go, or do what you're trying to do, but just kind of be cognizant of who's around you, and because you never know, your hurriedness or your rushingness may.
Lynnae is making some excellent points. That's all right. Technical issues happen. Please keep going. Yes.
Yes. So I would say for us in the community, as a healthcare, as a nurse who works in healthcare for the past 30 plus years, I would say it has made me more sensitive, more empathetic, because you see these patients in the hospital and you see them at sometimes a very vulnerable state, but they just came in from the outside. They just drove in here to have something done. And, so my job is to make them feel like what they're going through and who they are is the most important thing to me for them right at that moment.
Wow, absolutely. And like I say, superheroes were certainly elevated during the pandemic. If never thought before, the fact that you all put yourselves in harm's way and then go home to your families. I want to go, if I can, and delve into that. The experience of the nursing and medical staff during the pandemic? What don't we know happened that you feel like everybody should know?
That's an excellent question. I was just talking to one of my coworkers about it, Stephanie, and we were talking about, during the beginning of the pandemic, no one knew what was going on. None of us knew the impact of this. And so many of the nursing staff, the doctors, the respiratory therapists, the nurses, the transporters, we put ourselves in harm's way because we didn't know. We didn't know. We didn't know. So we were just like, we saw this influx of patients coming through. We were just trying to care for them and keep things moving, keep the ER decompressed because they were getting just hammered. And then you had patients having surgery who didn't even know they were sick. And so so they're coming into the family lounge, getting registered, and they're coughing and they're hacking, and we weren't masking at the time. We were just like, oh, they have the flu. What is that? What's going on? So it was very scary. And then we realized what was happening. You know, we were just as scared as the community was. We were just as nervous. And some people, not a lot, but quite a few people say, you know what? I'm out. I didn't sign up for this. This is too risky for me. And other people, many people hung in there because, they felt that that's what they were supposed to do. That was their calling. So it was a lot of variable responses. None of them were wrong because you have to take care of yourself. You have to do what's right for you. You have to respect that people's decision, whether to show up for work or to not show up for work because it was a very scary time. But I would say that's the biggest thing I remember is just, this was a lot of uncertainty, a lot of I'm not quite sure. I don't want to bring this home to my family. There was a lot of that. There's a lot of that. I have a newborn baby at home. So there's many of the nursing organizations put nurses up in hotels, which was great. So we didn't have to go home. We didn't have to take it home. We could just say, you know what, I'm going to stay at the next door Hilton or the Hyatt or the Marriott and wait until, to see what happens. So it just all depended on the nurse or the doctor or the RT or whoever else we were dealing with. But, from the person working in the cafeteria to the person cleaning the room, all of them were impacted, all of them. And many of them still came to work every day. It was fabulous. It was the commitment to patients was just was phenomenal.
One of the things that you mentioned was how it's a healthcare system. We don't often think about the environmental person, the janitor that comes and cleans rooms as people leave, breathing in that same air and then going
Yep.
home to their family. We don't often think about the ones who's taking your payment or who's at the front desk when you check in or who's passing the clipboard around to get paperwork. We don't, even the security at the hospitals that are the first line of being able to protect folks, sadly, just a whole system that had to step up. With that, you work in multiple systems. Like your expertise is so amazing that you are with, again, I want to share John Hopkins Hospital, which is one of the top education hospitals in the country, and the University of Maryland Medical Center, which also spans not just the whole state, but has global online education options. So you don't just, again, impact the patients and the work you do daily, but you pour into other nurses to try to enrich them. Tell us what we should do if there are individuals who just feel like maybe the healthcare system is something I do want to go in. What tips or advice would you give?
I would say, please, we need the support, but only if you want it and only if you like people. We have some people coming into the healthcare profession, and you can tell if they really don't care for people. And we're a people service profession. We serve people sometimes at their most vulnerable state, and some of them can be quite mean because they don't feel good, and so they're not going to be in the best of moods. and you have to be able to let that roll off your back and not take it personally. And hopefully when they feel better, they'll be in a better mood, but that's not up to you. You just got to still care for them and give them your best self. But I see sometimes, I see certain people getting into the profession now that they shouldn't be in nursing, because nursing is about caring for people, compassionate, empathetic. Um, and some people, that's not their cup of tea. So it's not a good thing. But I would say that it's a great profession. It's a service-oriented profession. So if you'd like to serve, I'd say nursing, respiratory therapy, physical therapy, occupational therapy, child life specialists. There's a lot of different venues that go through healthcare. But to speak about nursing, I love being a nurse. It's the best part of me, or not the best part of me. Being a mom and a wife is the best part of me, and also a child of God. But I would say nursing is like number four. And I'm glad I chose it. I'm glad I am a nurse. And I love being a nurse. I love caring for people. I love showing people how to do better. It's their choice whether or not to do it or not, but at least they can't say they didn't know. I try to help them do better, regarding caring for themselves. But I would feel that if you want to be a nurse, you get into your sciences, get into your biology, pathophysiology, all those different things in school, the sciences. You need to know math. Math's important. You got to calculate drugs, so that you can administer them appropriately and not give too much or give too little, because patients will notice if you don't give enough, and they'll be in pain, and then you have another problem that you got to deal with. So I would say nursing needs people that want nursing, and healthcare in general, again, needs the people that actually want to do the work.
Man, we can see as you speak how important this work is. And the basic tips of math, science, and compassion is everything. Okay, so there's a whole nother side to you, Miss Elliotte, that is just amazing in the fact that with all you do in your day, and all you do flying and training and speaking at conferences and teaching and all, and then working at hospitals, you are one of the main individuals who took the initiative to start a healthcare community in the faith-based community. So much so that you were on the news doing workouts, and they invited you to big venues and conferences with your teams, mic'd up. You partnered with the Ian Smith 50 million pound challenge and so many different
Yes.
things, and birthed a 5K that takes place every year in the Washington, D.C. area. How, in my goodness, the world do you take that side of you? Oh, and you're a fitness instructor who teaches workout classes. Talk to
Yes.
somebody who feels like the job is it. How you don't even see the job as it, but make it your lifestyle.
Wow. I would say it's who I am. I love I love health and fitness. Health as a nurse, that started off there, but I just love, how it makes me feel. I love caring for people and showing people how to do better. And those are the venues that, were, I guess, presented to me at the time. And the whole thing with the faith-based community of fitness and wellness, that was an opportunity that I shared with you alongside of you. And it was nice to birth that and how it flourished. And it opened up either other avenues of teaching that I had not really done. I had been a participant in fitness many times, but never taught it. And it opened up, being a group fitness instructor with AFA. And then, wow, then it birthed me now being a jazzercise instructor, a certified jazzercise instructor, which I absolutely love. And I love it. And I think it brings my teaching. My master's is in, health education, nursing health education. So it brings that teaching into the whole form of teaching. But now I'm teaching actually people in front of me. We're doing fitness. We're doing, a little bit of sculpting. We're doing a little cardio, working the glutes, the abs, the arms, whatever we're doing, upper torso. So it's just, I really do adore it, and it really helps me feel good. I feel better, And because I feel better, I do better. I care for my patients better. I'm able to have the endurance to work, a 10, 12-hour shift sometimes if I have to, and not come home like totally wiped. Well, sometimes I do, but most times I don't. But I feel like the fitness aspect is such an important part of our lives. So, and I feel it's for everybody, but not everybody, gravitates towards it probably maybe as much as me, but I know many people who do, and they know that it's vital for us as a community to adopt movement into our life somehow, because we only get one body. We only get one body, and if you mess it up, you mess it up. So don't mess it up, or if you are messing it up, stop, and so do better.
Yeah, no, absolutely. Listen, and you're never too old to make a change. You're never too
Never.
old. Start right now. Maybe, like you said, maybe not teaching health and fitness, but deciding that you're going to move differently. You're going to do
Hmm.
something differently. Okay, so while you're in this inspiration mode, I also know you to be a true motivator, where folks leave feeling the fire that you have. What do you attribute that to? And could you take a minute and speak life to someone who needs to hear it today?
I would trip that to my walk with Christ. I I know He has put me on this earth to serve and to help people do better in a lot of different venues, whether it's at the hospital, whether I'm praying for somebody, or whether I'm teaching in front of a jazzercise class, or whether or not I'm doing some team workouts with my friends on another program that I do, which is called Eager to Motivate, E2M. I work on that out on that program as well, whether I'm any of those venues, or I'm at my church doing praise and worship. It's like I'm there to help other people do better, be better, see that it's possible. And I would say my words of inspiration would be take care of yourself and take care of others, because that's all you got. That's what we're here for. So if you don't take care of yourself, you can't take care of anybody else. So first thing, take care of you. And besides God in your life, you should be the next priority. You should be the next priority, because if you can't bring it, you're not going to be able to help anybody else. So you should make sure you are working out, you're eating right, you're taking care of your mental health, you're taking care of your physical health, your emotional health, you're getting your mindset, your mind in the right place, and then help somebody else do the same thing. Like you said earlier, diabetes, hypertension, cardiovascular disease, stroke disease, kidney disease running rampant in our community. I mean, running rampant, and most of us are kind of sleeping on it. We're not even paying attention. It's like, oh, they start me on a new medication. Ah, okay, now I have a second medication. Okay, that's not good. That's not good. Your kidneys are going to fail one day, or you're going to go blind from having long-standing diabetes, or whatever. It's just like, so we have to help our community get a grip and to stop accepting the decline of their health so freely. They just accept it, like, okay, I'm on three different medications. Okay, now I'm on insulin. Okay, I said, no, that's not going to end well. That's not going to end well. So we want to. So one of my goals is to really help our community say, stop accepting the stuff that you keep allowing your body to go through. You keep eating whatever you're eating, or coming home and sitting on the couch, and you think, well, one day I'll get up. Okay, I'll start Monday. Okay, I'll start next Monday. Okay, I'll start next Monday. You just keep doing that. And it's like, and next you know, years have gone by, and next thing the doctor's giving you another medication to put on. So it's just, I don't know. I feel like I want us to start taking care of ourselves and taking care of others and do better and choose to do better. Don't say, well, I'm going to do better, or I'm going to try. There's no try. There's do. Just do it. Quit messing around and do it. That's it.
I, I listen. The best part about this dialogue is you are hearing it from the woman who lives it. When people show up, they go to the hospital, she sees it. And not just in those two systems she's in, she travels the country dealing with this. And I thank you for reminding us to take care of us and to take care of others. Our family, we're going to hope that Lynnae has time to come back and be with us again. Certainly, there's so much in the medical field on the health front that we can continue to elevate. Lynnae, thank you from the Power Up team for your time today. I know we certainly took you away from some important business, but this has been more than valuable. We hope to see you again. Family, stay tuned. We're going into our next segment. I don't know how we're going to follow this, but there's more after this. Welcome back to the Power Up. We're glad that you're continuing to hang in, join, and listen and grow. All the information and inspiration that's already been shared. And now we're going to respond to a viewer inquiry. We had an email we received from a wonderful viewer who said, I need to change jobs and I'm not sure where to start. So thank you. And that's the short version of the email. Thank you for writing that question. One of the things that we often discuss here is professional development. So we want to take this opportunity to first thank you for acknowledging that there's a change that has to happen in your life, right? Sometimes changes are unexpected, not anticipated, maybe not even welcome. You have opposition to this change. You don't agree with the change, but doesn't mean the change isn't going to take effect. So it becomes how you deal with it. So what we want to do is share a few different tips that can help in the change process, especially on a professional development level. First, remember healthcare is important. You've got to remember that you're the one that's being impacted. A lot of times our jobs cause heart attacks. We deal with so much stress at work that individuals live with migraines. Yeah. People get so frustrated and meetings on top of meetings and staring at a computer screen for a long time that it takes a physical toll. So as you're dealing with the fact that there's now going to be a shift, there's now going to be a change, or even that you're considering a new job and have to make a move, as you grow into what you're about to step into, because this is only a level up, it's another ring on a ladder, it's another step up the mountain, it's only going forward. One thing we're not doing is putting the car in reverse and going backwards. So as you're moving forward, remember healthcare, how you eat, what you drink, exercise, some way to release, there we go, all the frustration that we pin up when we deal with the stuff of life. Okay. Another thing is to make sure that you keep learning as part of your professional life. People ask often, because I'm a trainer with the federal government, what do you do? How did you get that job? I constantly have to stay in training. And trust me, I'm nobody on a lot of levels to a lot of other people. But what I do, I believe is my responsibility to do in excellence. So I'm always growing. I heard a amazing expert say one time, always be a student. Never get to a point where you know it all, because that's your ceiling. Now, you might not go back to school to get a degree, but there are online certifications that will teach you new trends. They will teach you what new school is doing versus what you knew 30 years ago. Yeah, you want to keep your knowledge ever growing. I'll share this. That's one of the reasons why sometimes seniors struggle with technology. But when grandbaby shows up, grandbaby can show grandma how to work that tablet, how to work that iPhone, as long as grandma is open to embracing the new, because it's not over till it's over. So how about stay relevant with the times? So make sure you're dealing with your health, mental health, physical health, what you're eating, your nutritional health. And make sure that you're also staying relevant in your constant learning. I'm an advocate for Google. Listen, you can Google anything. For YouTube University, you can listen to tapes while you're walking, motivation podcasts. Get tapped into some amazing nations like the one this network has birthed, the We Empower Nation, where you're connected with people, executives, or leaders on every level that just grow together and constantly share inspiration and information. Another thing to remember is limit your obstacles and distractions. So while you know there's something that's in front of you, make that your focus. Eagle eye focus. If you're looking for a new position, if you know there's new positions out there, then you've got to make time for a job search. You have to make time to update your resume. And here's the thing, you may need multiple versions of a resume because your resume has to speak to the job you're applying for. Now, I absolutely am not supporting cutting and pasting. You don't take the job description and drop it in a resume and think that's it. However, sometimes in order to get in the door, there are buzzwords that have to be part of your experience that are reflected on a resume. Well, if you haven't made time to learn the lingo in this new area, then you're not going to be one of the ones selected. I'll give you an example. Let's say you've been an accountant for 30 years. And now you decide, you know what, I want to go in the medical field. Well, the medical field needs accountants. They need folks that deal with the money. It's a business. And we need the nurses paid. We need to make sure billing insurance can be billed. So have you looked into what current insurance codes are? Have you considered the jobs in billing and in accounting? So that as you walk in proud that now I'm putting my skills and my experience in an area that will make me happy, that I enjoy working in, that I'm also growing in the knowledge so that I'm the one that's prepared to be selected for that job. Listen, shifts in life happen. Life is not a permanent state, it's a temporary state. Just like books, there's chapters, there's volumes. Just like movies, there's scenes. Well, what's in front of you is the next volume, it's the next scene. But what you do in this moment, even in moments of uncertainty, even in moments of man, I don't know which job to get, nobody's calling me back, keep interviewing, keep applying. But it's your time management and making sure that you don't allow the naysayers to distract you from your goals. Eagle eye focused. You ever saw the picture of an eagle going for its prey? Its wings are pushed back, its claws are stretched forward. All it sees is the target ahead. Make your target, I'm going to get a job I love. Since I have to get a new job, since they fired me, or they're getting ready to lay everybody off, or they told me my services are no longer needed, or I just don't like the job anymore. I'm going somewhere where I'm going to be happy. As you pursue and start to walk in that, make sure you remain healthy, Make sure that you remain educated. And that means learning new information. Open your mind to new people, new networks. If you've always wanted to go into education, start getting education magazines. That way you know what's happening in the education industry. Transportation. Let's say you decide, I love planes. I'm going to take my skills and figure out how I can get in the transportation industry. Guess what? They need you. They're waiting for you. Can you speak the lingo? Are you aware of what terminology means? So that you're not just taking a job just to be right where you are right now, miserable again. And what have you done to research the agency you're looking to go to? Have they recently had a lot of layoffs? What are they looking to advance? That's what you want to know. I'll give you an example. In the medical field, there are some folks who choose to go into the field of oncology because maybe they dealt with family members who fought cancer. That's a great desire for hard work. But as Lynnae just said, if you can't be nice first, if you're not a person of compassion dealing with people, because when I show up feeling sick, I promise you probably not going to get the nice side of me because I'm at my worst. But can you be at your best in the face of what's worst? So if you know that soft skills are something you need to grow in, take this opportunity to learn communication tips. Take a communication class. There are so many free classes going on at universities, in community bases. There are different places and ways you can tap into. Listen, there are Facebook groups. There are professional development classes, courses, even podcasts. YouTube. I listen to YouTube videos all the time. And my goal is not to listen just to say I did that. My goal is to listen to learn something new. So even if it's someone who's doing exactly what I'm doing right now, their approach might be different. So I just learned something new, a new approach. How they discuss things might be different. I just learned some new communication tips. Maybe they're using a totally different platform. Wow, I just learned that even existed. Didn't know it before. So in this moment, in responding to our reader inquiry, we're glad that you're actually in a place where a shift is happening. Some folks feel stuck in their jobs. They feel stuck in life. Like, this is it for me. Oh, no. You have the power to change everything around you so that you are living out loud and on purpose. You just have to decide, this is what I'm doing, and then put those steps in place. Reminding you of our tips again. Healthcare matters. What you eat, you drink can help to release the stress. Movement, as Lynnae was saying, what you do right now can help to alleviate that pressure so you don't have those headaches. So this isn't burdening you down. It's just another process in life. Making sure that you limit those distractions. So it's not about what the people say you can't do, what you don't have. It's about growing in what you feel is a weakness so that that thing becomes your strength. Why not? It's also about making sure that you remember that this is just the next step on your journey. You want to be somewhere looking back at 80 saying, I did that. But unless you're 80 right now, that means you have time in front of you. Live every day, every moment, like it's your last, and enjoy the journey. You know why? Because you deserve to be happy. We hope those tips were helpful. We are rooting for you, whoever you are. When you get to the place where you feel like you can write us back and let us know how this advice helped you, send us communication. Tammy@thepowerup.net. We want to hear from you. And if you have a question you want to propose to our production team, our experts, we can bring them in to address all of the inquiries we're receiving. Family, we're going to wrap up. Wow, what a powerful segment. Hang tight. We'll be right back.
What's up, family? It's your girl, Terry Y. Hicks, 1/5 of the amazing queens of empowerment from the Empowered Morning Show. And I am here to personally invite you to join us for the premiere of our brand new show, Queendom Behavior. That's right. We have a brand new show coming out. And before the world gets to see it, we want you to see it. So join us April 27th at 8 p.m. in Douglasville, Georgia at Studio T on Chapel Hill Road for the premiere of Queens of Behavior. It's a red carpet event, so make sure you dress for the occasion. We can't wait to see you there.
Welcome back to the Power Up. What a power-packed day. We started by elevating the alarm by the U.S. Agency of International Development on the humanitarian efforts taking place in Sudan and Haiti. How important it is to elevate your knowledge on what's happening with our brothers and sisters across the water and how you can help. At most, getting information and being knowledgeable so you can empower those around you. You don't know if your coworkers are Sudanese, if that's their family members that they're concerned about. And maybe that might be why they're having an inability to focus every day. But if you have the knowledge, you have the power. Go to usaid.gov. Get information on the humanitarian effort taking place and how you can help. We also shared information from the World Health Organization. They are also setting an alarm, sounding an alarm to make sure that we are aware of the top causes of death globally, of which on that list is diabetes. Many folks, to Lynnae's point, pop pills and think that's the end. There's so much more you have the power to do, but you have to do it. Go to who.int. The World Health Organization has pages on all of the information, on statistics that have taken place over the years to show the rise in heart disease. Family, do you know that if you don't have a pumping heart, there's a problem? Heart health should always be number one. And there are some things you can adapt in your daily life. You can adopt new habits. You can find ways just to do little things that make a difference to help you live well, live longer. Go to who.int. I live what I speak of. In my water, I have infused lemon, ginger. I have infused cucumber. It makes a difference in flushing my liver. I'm on medications. So I have to find ways every single day to help make this body a little better. So my goal is to get off the medications, but it starts with what I do, a daily habit. Thank you for our guest who joined today, Lynnae Elliotte, amazing registered nurse with Johns Hopkins Hospital and the University of Maryland Medical Center. She is a trainer to other nurses, a nurse manager, 30 years in the medical field. Doesn't sound like she's going to stop anytime soon. And then took the love and care for people and birthed community efforts. There are churches now that have fitness programs because she started one. Some of those folks started attending hers and then went to their churches and said, well, we can start that here. There's a 5K that takes place, the Faith Strong 5K in the DMV area. I believe the next one is Saturday, May 18th. So if you're in the Washington, D.C. area, come on and join the Faith Strong 5K. But how she took her calling, her love, her passion, and didn't just put it in the 9 to 5, but found a way to impact community well-being. And then Lynnae left us with the challenge for us to be better to us, care for ourselves. Start today. She said, don't just talk it, do it, and care for those around us. Because when you're well, you want to make people well. So during the health front, she came and joined and poured into us. And y'all, I want to know, I threw her that curveball question about how was it to be part of the medical field during the pandemic. So I thank Lynnae for her transparency, how talking about how they were slammed, they were scared. They didn't know what was happening. And her rawness in being able to share from a nurse's approach with folks coming in, having to deal with what she was living in. And thank you to the agencies who put the nurses up in hotels to make sure they were safe and their families were cared for. It takes us all to make a difference where we are. We ended with a response to one of our viewers who asked about professional development tips because they have to now find a new job. Now, without going into the details of that individual circumstances, we all find ourselves in that position at times where we just want to be better. We may have a shift in life, a shift in a career. Shifts should be welcome. Get to a point where we're so open to new, to growth opportunities, to what's ahead, that we create habits that sustain us when life has changes that we have to endure. Again, the pandemic wasn't a welcome. The flu isn't something we embrace, but it's something we can prepare for. It's something we can stay healthy during. Grow your skills as you continue to always be a student, always taking classes, always listening to podcasts, always connecting with positive energy. I shared a few days ago on an interview. If you can't read while you're in your position, if you're not the person able to open up that hard copy book and highlight and sticky like I do, get an ebook where you can listen to it while you're driving, while you're commuting on that metro or MARTA or train or subway back and forth to work. While you're on that plane, you know you have a 2-hour flight. Go on and download the book so you can listen to it in flight. Family, there are things you can do to be the all powerful you. What we're not going to do is quit and live in excuses. This is the time you can decide, I'm going to create daily habits. I'm going to make sure that I do things to better me, and I'm going to stay vision focused on what's ahead. Limit the distractions, limit the noise. Instead of picking up your phone first thing in the morning and scrolling, how about leave that phone for a minute and put that positive music on while you're getting ready? Do what you need to do to get you ready for the battle ahead, because we don't know what the day holds. We know who holds the day. Family, we want to make sure that as we go into our wrap up, we highlight some amazing achievements by many inventors, many of those being Black inventors, those who helped create this America we live in, and a lot of the things we take for granted, like Mr. Philip Downing. Did you know he created the mailbox? How about Mr. Garrett Morgan created the traffic light? You're in that hurry, but you're going to stop at some point. How about Mr. Richard Spikes? Richard Spikes created the automatic gear shift. Thank you for those of us that struggle with that shift, that gear. Come on, going from the first gear to second gear to third gear to fifth gear. I tried, y'all. It didn't work for me. So I'm grateful for the automatic gear shift. These are individuals who took the inventions, the ideas, birthed them, and now look at how they're part of our everyday life. We so thank the opportunity from Mr. Harry T. Sampson, who listen, he did himself get a PhD in nuclear engineering so that we could be better. You know what he invented? The patent for the cell phone. We've got to remember that while these are trailblazers, this highlight during the wrap up is meant to encourage you, because the ideas you have, it's not about whether others are doing it, because you see it differently. And the way you see things are what we may need in the future. Thank you, Marion Croak, who took the opportunity to add improvements to online voice and data systems. In other words, what she created was video conferencing. You can see me while I'm talking to you. That's one of the things that definitely became needed and necessary during the pandemic. And how about those who love American Idol, for example, and you cast your vote? Thank you, Marion Croak. Her patent, her technology, her ideas, her inquisitiveness is what made all of that possible. So we're always going to take an opportunity to elevate those trailblazers in front of us and hope that you understand the power in you Tap into that uniqueness about yourself. If you see a need, you can feel the need. Create the things that happen. Make money off of that and see how wonderful our future for our grandbabies and then their grandbabies and then their grandbabies can be. All because you said yes. You decided that I'm not just going to sit and exist anymore. I'm going to write all of this out. I'm going to get with a mentor or a financial advisor, see what it takes, maybe a coach to help me process this. And with those who feel stuck, maybe a therapist that can help me get through my emotional struggle. Oh, yeah, whatever you need is at your fingertips, but you have to access it and you have to start right now. We thank everybody for joining us. What a powerful segment. I'm excited for the next Power Up. Family, as always, we do thank our medical professionals on the front line every day, standing, finding cures for diseases, new diseases that pop up every day, and all that they do. We thank you. We thank our veterans who have served this country and our active military right now for sacrificing yourself from your families to protect our borders, to make it safe for us, to have the freedoms to disagree. How about that? We also want to thank our law enforcement, 911 responders, firefighters, medical professionals. Listen, anybody who runs in harm's way while everybody else is running away, we thank you for your courage because that is also a gift. And we want to leave you with this thought. What you do with this moment will soon be a memory. So how about maximize the present? Because it's a gift. It's the present. So that your future reflects all the steps and ideas and habits and practices and things that you do right now. And again, if you don't know where to start, start by talking to someone who can help. Sometimes it's taking pen to paper and just pouring out, doing a data dump, just pouring out the ideas you have. Just write them down. Even if you don't know what's going to happen, if they're ever going to happen, just get to writing. Because when you write the vision, you can make it plain. You can see the steps that I need to. And then get that spark, family. You ever thought about writing? You love reading? There are ways you can be an author. And it's not difficult. It's just connecting with someone who's been an author. You don't have to create the wheel. If you've always decided, I love kids and I want to start a daycare, it's never too late. There are parents looking for somebody to love on their babies while they go to work. But you've got to learn the systems, the requirements, the certifications, the insurance. You've got to learn all of that. And you can start today. It just means you have to start today. Thank you for being part of this Power Up. We hope you feel encouraged, equipped, educated, and then go elevate the community around you. We'll see you next time.